Hey, welcome. Today we're going to tackle a really important class of medications, one that has totally changed the game for people with autoimmune diseases. We're talking about DMARDs. So picture this. Your immune system, the thing that's supposed to be your personal bodyguard, gets its wires crossed. Instead of going after bad guys like viruses, it starts attacking your own healthy tissue. It's basically friendly fire inside your own body. That's the core problem of an autoimmune disease. So how on earth do you get your own army to stand down? Well, that's where DMARDs come in. You can think of them as the peacekeepers. Their full name, disease-modifying anti-rheumatic drugs, is a bit of a mouthful, but it tells you exactly what they do. They modify the disease, calming down that overactive immune system to slow down or even stop the damage. So here's our game plan. We'll quickly go over what DMARDs are, break down the two major types, conventional and biologic, then we'll dive into how they each work, what the risks are, and, importantly, how doctors make sure they're used safely. Okay, let's start with the big picture. Unlike a painkiller that just, puts a Band-Aid on the symptoms, DMARDs are designed to get to the root of the problem. They're meant to actually change the course of the disease by getting that haywire immune system back under control. And their use is incredibly widespread. I mean, look at this list. We're talking everything from different kinds of inflammatory arthritis to major systemic diseases like lupus and inflammatory bowel disease. It just goes to show how fundamental these drugs have become in medicine today. Right, now this is where it gets really interesting. Not all DMARDs are the same. They generally fall into two big categories, and they use completely different strategies to get the job done: conventional and biologic. The easiest way to think about it is this. A conventional DMARD is kind of like a blanket suppressor. It dampens down the whole immune system. A biologic, on the other hand, is more like a sniper. It takes aim at a very specific molecule or pathway that's causing all the trouble. And this table really lays out the differences. Conventionals, like the very common drug methotrexate, are nonspecific, and crucially, they can take months to really kick in. Biologics, they're super specific and can start working in just a matter of weeks. That difference in speed and precision is, as you can imagine, a huge deal when you're deciding on a treatment. So let's pop the hood on these, starting with that broad approach. How do conventional drugs actually pull this off? Let's use the most famous one, methotrexate, as our example. It's actually a pretty cool chain reaction. First, methotrexate blocks an important enzyme. This causes another chemical to build up, which then leads to another, and, well, you see the cascade. But here's the magic part. The whole process ends with the release of a really powerful anti-inflammatory substance called adenosine. You can think of adenosine as the final ceasefire signal that tells all those angry immune cells to just calm down. All right, now for the targeted strike of the biologics. These are much more like, molecular assassins. They're engineered to go in and intercept one very specific part of the inflammation process. This slide shows that precision perfectly. Okay, let's take a JAK inhibitor, which is a type of biologic. You've got these inflammatory messengers called cytokines, and they're trying to deliver a message to a cell that says, hey, start causing inflammation. That message has to travel down a specific communication highway inside the cell. But baricitinib, the drug, gets there first. It sets up a roadblock on that highway. The signal gets stopped dead in its tracks. It never reaches the cell's control center, so the genes that cause inflammation never even get the message to turn on. It's really incredible. Of course, anytime you're dialing down the immune system, whether it's with a broad approach or a targeted one, it's not going to be without some risks. So let's talk about the rules of engagement and the potential side effects. For conventional DMARDs, since they have that broader effect on the body, the side effects can be more systemic. We're talking about things like potential stress on the liver, a drop in your blood cell counts, nausea, and just general fatigue. With biologics, the risks are a bit different, a bit more specific. Because you are so precisely targeting one part of the immune system, the number one concern is an increased risk of certain infections. It can even mean waking up old viruses that have been sleeping in your body for years, like tuberculosis or hepatitis. It really is the direct trade-off for that incredibly targeted therapy. So with all these potential risks, how do doctors actually manage them? The key is pretty simple, but it is absolutely non-negotiable. It's all about careful and constant monitoring. Before a patient even gets their first pill or injection, there's a whole pre-flight checklist. This means screening for things like hepatitis and TB. That's especially important before starting a biologic. And for women who could become pregnant, a pregnancy test is an absolute must. And the check-ins don't stop there. Throughout the treatment, regular blood tests are needed to keep an eye on liver function, kidney function, and blood cell counts. For certain drugs like hydroxychloroquine, you even need to get regular eye exams. The whole point is to stay one step ahead and catch any potential issues before they become real problems. Now, there's one area that requires extreme caution, and that's pregnancy, because some of these drugs are absolutely not safe for a developing baby. This is a big deal. And this slide really breaks it down. Some drugs, like methotrexate and leflunomide, are completely off limits. They are known to cause birth defects. Others, like hydroxychloroquine, are actually considered safe and are often recommended for lupus patients to keep their disease under control during pregnancy. And when it comes to biologics, one called certolizumab is often seen as a safer choice because it's a large molecule that doesn't really cross over the placenta. So there you have it. We've gone from the sort of shotgun approach of the older conventional DMARDs to the laser-guided precision of modern biologics. Every single step along that path has been a massive leap forward for patients. But you know this evolution isn't over, which leaves us with a really exciting question. As we get even smarter about how the immune system works, what does that next frontier in fighting autoimmune disease even look like?